Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Leaving the hospital is usually something to celebrate, but did you know it's also full of risks? Whether you're heading home or to another care facility, those first few days or even weeks are critical. And if you're not careful, you could end up right back in the hospital. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we're talking about care coordination, and whether you know it or not, it's a big part of your health care. Stick around, we'll be right back. Welcome back. I'm sure you know that our healthcare system isn't always easy to navigate, especially if you have multiple doctors and other healthcare professionals you work with to help take care of your health. Today we're going to talk about how healthcare providers everywhere are trying to make that easier for their patients, while working to avoid unnecessary trips to the hospital or to the emergency room. We start off this morning talking with Amy Emmert. Amy, thanks so much for being here this morning.
Thanks for having me.
Can we start out by talking about what are some of the common reasons that people do end up right back in the hospital after they leave?
Yeah, so there's actually a lot of reasons that patients can end up back in the hospital. Those can range anywhere from medication errors or medication adverse reactions. And those situations we really try to avoid, but it's necessary that we have the right information on what patients are taking when they come into the hospital or the emergency room, and then transferring that information back and forth. And the information transfer itself is actually very crucial. So if the hospital doesn't necessarily inform the physician on that they were in the hospital, we may not know that we need to follow up with them, and they may end up back in the hospital or in the emergency room unnecessarily. Other reasons might be, lack of transportation, lack of resources when the patient goes home, or actually even not necessarily having reliable resources out in the community. And I don't necessarily mean that in the situation that they're not reliable resources, but that we've sent the patient home with a plan saying to follow up with your provider in 7 days, but your provider doesn't have room to see you in the next 7 days. So those are some key areas that might bring a patient back, but they're all, there's multiple reasons.
Okay, and so across the country right now, there's a big push of trying to help improve some of that information transfer to try to keep people out of the hospital, and a number of other things that would benefit from what's being called care coordination. Can you tell us what care coordination means? Yeah,
so care coordination, I guess when I think of it, I really think of a game when we played when we were a kid of connecting the dots. And it's really that we need to move away from thinking of healthcare as, you've got your cardiologist and you've got your primary care provider and you've got a hospital stay, and that they're completely separate. And that's not the case. They have to be very, very connected, and we have to figure out ways to be able to connect those dots to each other and make sure that that information is shared and that people know the right information at the right time so that we can provide the right care.
Okay, so just to help us make sure we understand what we mean, can you give us an example by maybe talking about, hypothetically, a patient who has gone to the hospital and what that good care coordination would look like?
Yeah, so that care really starts once that patient hits the hospital floor. Hopefully by that point in time they've had either a conversation with the primary care provider or the cardiologist or whatever. But let's say Mr. Smith hits the hospital floor and he's admitted for congestive heart failure. The hospitalist at that point in time would either look at the records if they have access to them, or give a call to that primary care provider or the cardiologist to get a better understanding of the medications that they're on, the plan of care that's already been put forward for that patient, and really get a good sense of what the care is going on at that point in time. From there, they're going to put a plan in place for addressing the issue at hand. As they look at the plan of care, they need to look at it from the point of how do we make it so that the patient can sustain this plan of care after they leave the walls of the hospital. And so we really need to put an emphasis on, with the nurses inpatient, to make sure the patient understands what they need to do when they're going home, the new medications that they're on, any side effects to watch for, who they're going to be seeing and when they're going to be seeing them for, and the reason they're going to be seeing for that provider. Other areas might be really talking about the disease itself. So helping that person understand what is congestive heart failure, what's going on in their body, and how are ways that we can help avoid some of the symptoms or signs that are presenting for that patient. So in congestive heart failure specifically, talking to the patient about their diet. So avoiding salt intake is a huge thing with congestive heart failure. And so with that is also the importance of, taking daily weights. If patients don't understand, if they're not weighing themselves on a daily basis, they may not understand that actually, an exacerbation of their congestive heart failure might be, coming down the pipeline for them. And so they need to understand signs and symptoms that they should be aware of, and then who to call when those signs and symptoms present. Because we could avoid a hospital stay. We could get them back into their primary care provider or their cardiologist to prevent that readmission.
And why is care coordination so important, not only for the patient, you already gave some examples there, but also for the providers that are helping and working with that patient?
Yeah. So once that patient goes home, that's where, we really need to figure out how to connect those dots again. That transition of care is critical in any setting, whether that's from going from the hospital to home, or maybe from a nursing home back to home, or even from the primary care's office to the cardiologist. And so if we, again, make those ways of communicating back and forth to the providers and the care team members, the patients are going to be healthier. We'll hopefully avoid, unnecessary readmissions or visits, and that they are better engaged in their care and understand what they need to do and the aspects that they need to take care of.
Okay, we'll be back to talk with more with Amy and the importance of coordinating patient care. So far, we've talked about what patients and health care professionals are doing to help. After this, we'll talk about how a care coordinator can help you. We'll be back after these messages. Don't go away.